Kenya to deliver his inaugural keynote address and the opening address of the World Health Summit. Thank you very much.
Please, ladies and gentlemen, let's take our seats. Your Excellencies, honorable ministers, ambassadors, distinguished scientists, innovators, delegates, ladies and gentlemen, good morning and welcome to Nairobi and welcome to Kenya. I welcome you all to Kenya for the World Health Summit Regional Meeting 2026, an important event that reflects a fundamental in the global recognition that Africa is no longer a passive participant in global health, but an active architect of its direction, priorities, and outcomes. That this summit is convened on the African soil for the third time is an acknowledgement that the future of health policy, innovation, and delivery cannot be meaningfully advanced without Africa at the front and center of both deliberation and also execution and implementation. On behalf of the people and government of Kenya, I convey our deep appreciation to all partners and institutions whose foresight, collaboration, and commitment have made this gathering possible, and to each one of you whose presence here represents the full spectrum of leadership required to drive meaningful change in this space of health. You have already been welcomed to this compound by the Director General of UNON, and she said correctly that this is the only UN headquarters in the Global South. But let me add that it is the largest UN campus in the world. Because the government of Kenya did give 140 acres years ago to this institution, because we believed then, as we do today, that global action gets everybody to the right place, and we can find solutions, not in isolation, but we can find solutions together. We are believers, and I dare say very strong believers, in multilateralism and collective action. This summit is anchored on a clear and urgent imperative. It calls on us to reimagine Africa's health systems through innovation, integration, and interdependence. It challenges us to design practical pathways that translate into better outcomes for health in our continent. Africa today stands at a critical intersection defined by stark disparities and immense opportunity. We carry, on one hand, more than 25% of the global disease burden, yet account for less than 3% of global health expenditure on the other hand. We remain heavily dependent on external supply chains for essential commodities such as medicines and vaccines. We produce less than 2% of what we consume. At the same time, despite the dedication and resilience of our health workers, the density of our workforce remains significantly below global benchmarks. This imbalance is neither sustainable nor tenable. It calls for a decisive and deliberate shift from fragmented piecemeal interventions to a comprehensive and system-wide transformation anchored in coherent strategy, financed through both domestic and global capital, and sustained by strong governance and accountability institutions. At the same time, Africa possesses unique advantages that must be fully harnessed, including an energetic and useful population, rapidly expanding digital infrastructure, and a vibrant culture of innovation, which together position the continent as a source of scalable solutions rather than a repository of persistent challenges. Our responsibility, therefore, is not merely to recognize Africa's potential, but to fully realize it through coordinated investments, policy alignment, and institutional strengthening that can deliver impact at scale and speed. Ladies and gentlemen, in Kenya, we have sought to translate this vision into action by undertaking a comprehensive reform program that places health at the center of our national development agenda, recognizing it as a driver of productivity, equity, and long-term economic growth. To us, health is not a cost. It is an investment. We have enacted transformative legislation that establishes a durable framework for universal health coverage, ensuring that reforms are not dependent on political cycles, but are anchored in law, institutional continuity, and public accountability. Through the Social Health Authority, we have implementing a unified financing model that expands risk pooling, reduces out-of-pocket expenditure, and ensures that access to quality health care is determined by need rather than income or geography. Since its launch in October 2024, nearly 30.7 million Kenyans have registered as members of SHA. This means that the number of Kenyans with health insurance has grown nearly fourfold from 8 million just 2 years ago. In the same period, we have collected 169 billion Kenya shillings, that's about $1.3 billion, in the Primary Health Fund, the Social Health Insurance Fund, the Emergency Chronic and Critical Illness Fund, and the Public Officers Medical Scheme Fund. And we have paid out 124 billion Kenya shillings, close to $1 billion, as reimbursements to facilities for care provided. Through a strengthened primary health care system, we have expanded our community health system and deployed more than 100,000 community health promoters across the country, enabling care to reach households directly and ensuring early detection, prevention, and continuity of care, as well as effective linkages to secondary and tertiary facilities. Through sustained investment in digital health systems, we are integrating data, improving transparency, and enhancing decision-making, recognizing that effective health systems depend not only on infrastructure and personnel, but also on reliable, real-time information. Digitalization is not only enhancing efficiency in service delivery, but also promoting fiscal accountability, particularly in the context of shifting global development assistance landscape. And I know I am speaking to policymakers. I know I'm speaking to ministers from across our continent. If I were to tell you from my point of view, the three significant things that will make the difference for us in this continent. Number one is policy leadership. You need policy leadership on matters health at the highest level, because it requires making difficult decisions. And if policy leadership is not aligned, you cannot make the decisions that will create the impact that you need to deliver health, especially if you are looking at universal health, health that reaches everybody and leaves nobody behind. The number 2 requirement from where I sit is we need to understand that first and foremost, delivering health is our responsibility as governments and as Africans. First and foremost. Any other assistance we get is secondary. The challenge that I see is that many of the leaders in our continent believe that it is somebody else's responsibility. It should be the World Health Organization, USAID, I don't know who, and all the other friends. That is how we go wrong. Delivering health is first and foremost our responsibility. And because it is our responsibility, we have to design ways and means of raising domestic resources to fund our health delivery systems. And it is possible and it is doable. I will give you Kenya's example. A couple of years ago, we used to contribute $3 for health insurance. $3. We then moved it 5 years ago to $15. The highest being $15. Of course, we didn't raise enough resources to be able to run our health systems, and these are for salaried people and people who can afford to pay. But in the last 3 years, we changed the financing model, and we said every citizen will pay 2.75% of their income into a pool where we use to pay for our health insurance. That has changed the landscape significantly. That is why I've just told you, in the last 1 year, we have raised $1.3 billion. Domestic resources. It is 3.5 times what we were raising 3 years ago. We haven't gotten richer. Our salaries have not changed much. But we just realized that this is not a cost, this is an investment, and it is important for us to invest. The difference is like day and night today. Why am I saying this? I am saying this because I know I'm speaking to policymakers. Some decisions have to be made. And the sooner we realize that it is our responsibility to raise, especially domestic resources, to fund our health, the better for all of us. And finally, the third thing I will want to tell you as policymakers is to leverage on technology. Technology has a way of injecting magic into things. Efficiency, accountability become easy when you leverage on technology. And you will find a lot of resistance to technology and to any adjustments on funding. I will give you an example. If you read one of the headlines of one of the newspapers today in Kenya, it's a big headline saying how teachers and civil servants have rejected our health system. That headline is not coming from the civil servants. It's not coming from the teachers. It is coming from business interests, people who have been benefiting from health insurance before. We used to spend, on teachers alone, we used to spend $200 million every year. Today, we're spending $140 million. We have saved $60 million. The fellows who used to make the $60 million are the ones sponsoring the headline because they have lost business. Right? So this is the kind of resistance you go through when you make the changes that create impact. If you ask teachers today in Kenya, they were limited to 900 hospitals. Today, because we changed the system, they have access to 6,000, close to 7,000 hospitals. They no longer have restrictions on which hospital they can go to. They used to have access to only one level 6 hospital. Today, they have access to all level 6 hospitals. And as I talk here, one of the person agreeing with me is a person who runs one of the largest hospitals in Kenya, the Aga Khan Hospital is right there. And he knows what I'm talking about. But you see, it is easy to be distracted by business interests, by cartels and people who profiteer from the health space. But you see, technology has really done the magic for us. Today, we have integrated our own systems together with the hospitals, so the hospitals can follow. They have, visibility of what is going on, and we can better manage our resources. And therefore, as I talk to ministers from our continent, and I talk to you from a position of knowledge and experience, policy leadership, technology, making sure that you raise local resources to first and foremost drive your health requirements. Any other support you get is secondary. These reforms have neither been easy nor flawless, yet they represent meaningful and significant progress for our people and a clear departure from the constraints of the past. We recognize that transformation is an ongoing progress, and as we advance, we continue to refine and to strengthen both the systems and its underlying architecture, learning, adapting, and improving to ensure it delivers fully and effectively for everybody. Kenya's experience demonstrates that when political leadership gives priority to health as a fundamental pillar of development, aligns policy with financing, and centers service delivery on communities, and transformation therefore becomes both achievable and also sustainable. Distinguished delegates, the future of Africa's health systems must be shaped through collective continental action that addresses both long-standing gaps and emerging pressures, including the rise of non-communicable diseases, the growing burden of mental health conditions, and the profound impact of climate change on health outcomes. And I believe that's the essence of this meeting, to bring all of us together so that we can share our experiences, we can learn from what others are doing, and we can pick from the best and do what we must. This requires deliberate choices, including increasing domestic health financing in line with our commitments, strengthening local pharmaceutical manufacturing capacity, investing in training and retention of health professionals, and ensuring that digital innovation serves as a tool for inclusion and accountability rather than exclusion. It also requires us to institutionalize preparedness for future health emergencies by strengthening primary healthcare services, enhancing surveillance systems, improving regional coordination, and supporting continental institutions capable of responding effectively and rapidly to emerging public health threats. In addition, Africa must position itself at the forefront of biotechnology and advanced research by investing in genomics, vaccine development, and local manufacturing ecosystems, thereby transitioning from a consumer of innovation to a producer of globally relevant solutions. And it matters when policymakers make those choices. I will give you an example of Kenya. We have almost 40 manufacturers of health commodities in Kenya. Some of them, like one company called Revital, export to the US, they export to India, they work with the World Health Organizations and many of global health companies that require commodities. But you will be surprised that the policy arrangements in Kenya did not recognize some of these manufacturers and actually excluded them from us buying commodities from them. And then you ask yourself, I mean, you are producing a commodity that is being imported globally, and you cannot buy it in Kenya. Why? Because, you know, I don't want to say. So policy makers must think through and support locally manufactured commodities as a way of building our capacity to be able to produce. And talking about Revital, Revital is a Kenyan company owned by Kenyans, you know. So when you ask the people at the Ministry of Health, why are we not buying from these people? There is a lot of English and words, and there is no substance, you know. So you as policymakers must have a keen eye on what is going on so that you make the right decisions. To our global partners, I wish to emphasize that Africa seeks partnerships grounded in mutual benefit, aligned with national priorities, and focused on long-term investment rather than short-term assistance. A healthy Africa is indispensable to global stability, economic growth, and shared prosperity. The question before the international community is therefore not whether to invest in Africa, but how to do so in a manner that is strategic, sustainable, and transformative. Ladies and gentlemen, again, let me welcome all of you to Nairobi. Enjoy your stay in this city. There is a national park around the corner. From your hotel, maybe it is anywhere between 10 and 15, maybe 20 kilometers, maybe 20 minutes from your hotel. And the national park is, we have wild animals there. They are not in the zoo. And occasionally, because we've tried to fence, but occasionally you will find they stray from the fence. You may find a lion somewhere if you do a morning jog. Please be careful. They are wild animals. And while here, enjoy the hospitality of the people of Kenya. We are carnivores. We eat a lot of meat. So you will find something called nyama choma. It is very well done roasted meat. Please enjoy yourselves and stay longer beyond this conference. And if for any reason you feel at home, which you will, it is because this is the origin of humanity. Everybody here has come back home. So enjoy. It is now my honor and privilege to declare the World Health Summit Regional Meeting 2026 open. Thank you very much.
Another round of applause for His Excellency and all the speakers. With your permission, Your Excellency, allow me to just give the exit protocols. We've come to the end of this session, and I'll give the exit protocols without using a lot of English. And we shall have a photo session by the stairs, and this photo session is for cabinet secretaries, ministers and principal secretaries present, together with our NEPAD lead. So at this point, I request that we be upstanding as we allow His Excellency to exit first, followed by the cabinet secretaries, ministers and principal secretaries as we proceed to do our photo session by the stairs. We'll have Kayamba Africa give us some music as we allow His Excellency the President to exit. Thank you, and do have a wonderful day.
Sore